Hey, everybody, and welcome back to another episode of County Talk. This is where, as you know, we do talk about the nitty-gritty issues that go on in the county and what would be concerning to you as a taxpayer, so you know where your money goes. We like to sort of shed light on things that you may or may not know about what we do here. I'm Sue Hansen. I'm one of your 3 elected county commissioners, and I'm here with a very special guest today, Kim Cook, who is works with our Nurse Family Partnership Program. So we're going to talk a little bit about that and learn more about the program. It's awesome. But first, we have some exciting news, and congratulations.
Thank
were
you so
named
much.
one of the KREX Remarkable Women. So tell me a little bit about that.
I just got a phone call out of the blue from one of the reporters from KREX and said I was nominated as one of their remarkable women, and they wanted to do a news reel on it. And so they came and interviewed me, and we spoke about the Nurse Family Partnership Program, because that's a very important part of my life is my work here.
You bet. It is really important. It's one of my favorite programs, and most people don't really know what that is. They know the county does a lot of things with health and human services and public health, but the Nurse Family Partnership Program is a little bit different, and it's special. So could you give us kind of an overview of what that actually is and what you do?
Yeah, it's kind of interesting. I had never heard of it before. I saw the ad in the paper, and so it is a program that is just for first-time moms, and I'm a nurse, and we go from when the mom is pregnant up until that baby turns 2, and we kind of walk alongside them as a mentor, as a nurse, as an educator, health educator, just as a person that they can count on.
So not only are you helping them with their pregnancy, you're also helping them learn parenting skills and asking questions and things like that. Are you surprised at I mean, I've never been a parent. I'm a stepmom, but there's a lot to being a parent. So do you cover things like that with your
definitely,
clients?
because being it's first time moms, most of them are very open to what we have to teach them, and being able to share with them and say, one of the things I tell them when I first enroll them is saying, I'm the person that's just going to give you information, and you get to choose what you want to take in. I'm going to tell you what I think's right, but you're the expert on your body, your baby, and you get to choose. I'm not going to push you to say, this is how you need to do it. And one of the things I say is want them to be the best mom that they can be. And many people are very anxious about that.
Well, yeah, there's a lot to it. It's not, I guess we think it's easier than it looks. It is difficult to be a good parent, and especially when you have the stress of a newborn. And some of your moms, this may or may not be their first child, right? Or is it
their first child.
Always their first child.
Always their first child.
Okay.
We have some that have stepchildren, so they might have some experience in other ways, and some of them don't have partners. Many of them do. And so some of the partners participate in the program.
Good.
And, come alongside.
Right.
Some don't at all. It's just whatever they want to. Sometimes we have what we call the grandmas will come in. And
So
also
you're teaching several generations at a time.
And with today's world, a lot of these moms come from dysfunctional families. They haven't seen good parenting. Often when I say, well, what do you want to do that your parents did? Or what do you want to do different than what your parents did? And they'll say, I'm going to do exactly the opposite of what my parents did.
Interesting.
And then we usually can find out some little bit that was maybe their parent did that was right.
Sure.
But on the, and then some people have great
Right.
Great
I think
parenting.
That all of us come from dysfunction. It's just a matter of
that's true. How much dysfunction?
Much, right? So I think families are
that
always
is probably true.
Complicated. But when you think about siblings and all of that, so we don't have a facility here. People don't come here necessarily. You mostly do home visits. So can you take me through a day of Kim Cook and what you might do?
Okay, I come in and I look at my schedule, and the day before I've already texted these clients to find out if they're going to be available for their visit, because they need lots of reminders that I'm making sure that I don't just go to somebody's house and they're not home.
Right.
So, and then I get my visits ready for the day, and I usually typically do 3 visits in a day. And so I try to get all 3 of those ready. And then I just start rolling.
Right.
I get in one of the county cars, and I usually have a lot of stuff with me. I have a baby scale, and I have a backpack with their chart and anything else I might want to bring them. We give them books all the time through Reach Out and Read. And we also give them like some developmental toys. Like they might not have a rattle. That seems very odd to us, but I'll say like, is your baby tracking? And I'm like, you have a rattle? And they're like, no. And I'm like, I'll bring one next time. You know, and just that they don't have the things for those babies to develop those developmental skills.
So you're really doing kind of a broad education. Not only are you helping them with what they're going to struggle with or encounter in their pregnancy, you're also then after they give birth, now you're helping them with all the developmental skills for the kids.
Right.
So you're kind of walking them through those things. I mean, I would have to have that kind of instruction. I'm not sure I would. I'd probably pick up a book, but a lot of people are busy and they don't have the opportunity to do that. So you cover several counties. I mean, so tell me. I mean, you might go to Delta. You might
right
go to
now,
Montrose.
I have clients in Delta County and in Montrose County. I have previously had them in Uray County, San Miguel, and I guess that's it.
Yeah. So we cover a region.
We cover a region. We have one nurse right now that's going to San Miguel and Uray. We try to kind of split up our areas, and all 3 of us nurses have some Delta clients. I have just one right now. I have been phasing out of the Delta clients because we have a nurse that's from Delta. And so we try to have those nurses that maybe know that area more.
Right.
And then we have a Gunnison nurse as well.
So I might be able to ask you what kind of diapers I should use, or what should I be doing with my baby? How often should I bathe them? I mean, all those kinds of questions that you get.
All those kind of questions. Yeah. And so we start in pregnancy. And so then we're talking about like just the prenatal care. How are you taking care of your body? How are you preparing to have a baby? Thinking about the baby, because we're also wanting to start them to be attached to that baby even in utero.
Right.
To recognize that it's a little human, and because the better attached they are to the baby, it helps when the baby arrives.
The better parent.
They're ready to, they already love that baby.
Right. So they're bonding with that baby.
They're bonding with that baby ahead of time. And so we talk about how do you talk to your baby, and how do you, do music with your baby,
right?
Even in utero. And it's really interesting. I saw a thing a long time ago, T. Barry Brazelton, which was a famous pediatrician from our day, and he showed a baby. He was holding a baby in his hands like this, 1 day old, and the dad was right here beside him. And Dr. Brazelton was like talking to the baby. Hi, baby, how are you doing? And he says to the dad, now say something. And the dad says, hi,
whatever,
Johnny. And the baby just went like
he's mine. Yeah, that's my guy.
That's my dad, 1 day old. And that baby recognized dad's voice.
Wow.
And so I tell that story to dads.
Yeah, that kind of gave me chill bumps because it's cool.
They're so important. And sometimes they feel left out at the beginning.
Right.
So I want them to know, like, if you talk to the baby a lot in utero, that baby will recognize your voice.
Right. Then you realize that,
afterwards
they can hear. I mean,
they can hear. And we especially make points that we talk about the fetal development, like when they can start hearing and when they can start seeing. So if you want to do a flashlight game on your belly and either get the baby out of your ribs.
Yeah.
Most of the time they go away from the flashlight.
Oh, okay.
But a few babies will go to the light.
Wow.
And then you just have to go the other way, to try to,
Well, that's cool.
So just helping them realize, there's good things about pregnancy.
Well, how long have you been with Nurse Family Partnerships?
17 and a half years.
So over those years, you learn a lot of tips and tricks and
yes,
tools.
definitely.
And you share all that knowledge. I mean,
sure.
It'd be... that's invaluable to us and to those moms to be able to have someone who has that kind of level of experience. So 17 years with Nurse Family Partnership. Well, congratulations.
Right. Well, thank you so much.
I mean, that's what makes you so remarkable because...
Well, it definitely helps because you have that experience and just the more knowledge that you have to be able to share with them. But a lot of it is we're listening. And my supervisor often tells us the nurse is the intervention. So, like when you go to the doctor, the intervention might be medicine or it might be a test or something like that. For us, we are the intervention. The listening ear, the person that can listen to them. And,
Right.
Sometimes we go into a visit and all we do is we sit there and say, oh, that sounds interesting. That must have been really hard for you.
So you're also, there's a therapy component.
There is a therapy component.
Right.
But we are quick to refer them out.
Right.
If they need therapy, and
But sometimes people just need a listening ear.
sometimes people just need a listening ear for that day, or for every
And
every
I'm
visit.
guessing that a lot of their questions are like, is this normal? This is what's going on with me. Is
Yes.
this normal? So, I mean,
Yes.
we want to be assured that this is a normal pregnancy and things are just, this is the way it happens. So,
Right. I have moms call me like, oh, my side hurts. You know what I mean? And I mean, if it's something that I know that that's just what it is. I'm like, well, it's this nerve that, is holding up the baby and this ligament that's holding up the baby, and that's what's causing you pain. And
Yeah.
if it gets worse, call your doctor.
Yeah.
Kind of thing.
Yeah.
And, and we teach them like labor and delivery. Many women are very scared about labor and delivery. And so we teach them relaxation techniques. What's going to happen? Because I think knowledge is power.
Right.
Knowing what the next step's going to be, and also trying to empower them.
Sure.
That they can speak up. If they are not happy with what's going on, that they have the right to speak up.
Because sometimes that can be an intimidating situation with a doctor and not knowing, especially somebody isn't familiar with the medical field.
Definitely.
Right? So, yeah, I think, the one battle against fear is information.
Right.
Right. And having someone with your knowledge and some of the other nurses that they can say, no, this is, you're fine. You're going to be good. It's such a reassuring voice for people like that. So I'm sure you've had scads of success stories and things
Yes.
that you remember, because part of what you do, your dedication to these women, it is really touching that we have someone with such a big heart that can connect with people, and with your personality, it's easy for you to connect. But tell us something, a few stories about people that you really felt like, wow, I really made a difference.
I have a couple of them, and one of them is early. When I first took the job, I thought I was going to get like teenage moms that are just scared and like, oh no. And I didn't see much of that. I saw more like 20-year-olds. And by the time I got them, they had kind of adjusted to the fact that they were pregnant. But one day into my office came a young woman, a teenager, and her boyfriend. They were 16 and 18. And she came straight from her doctor's office. And it just so happened that it happened to be my doctor. So she knew I was doing this program. So she referred her. She said, go right over to Nurse Family Partnership. I think they can help you. She just found out she was pregnant. And so I was able to kind of like talk her down and just help her to realize, like, it's okay. You're going to be okay. And we worked with these women 2.5 years.
Right. So, yeah, you get to know them
You really
well.
get to know them really,
Yeah.
really well. And her partner, who later became her husband, was very involved. In fact, he came to, I think, almost all of our visits.
Oh, that's impressive.
Because he was also a scared dad. You know what I mean? Like, oh, no,
Yeah.
my girlfriend's pregnant. And I have kept track with her. I see her around town. That's the one thing about being in a small town. You just see your clients
It is.
around town. And so I have them on Facebook a lot of times. And I just noticed she put that she is signing up for her master's degree.
Cool.
In education. So she finished high school. She took a little bit of time off and had a second child 2 years later. And then she went to school for early childhood education, got her teaching certificate, and now she's going for her master's degree.
Wow.
And I'm like, that is so cool, from that scared teenager. But even from that scared teenager to when I graduated, we called it a graduation when they finished the program, she was a self-confident young woman. Because we're not just developing their parenting, we're helping them develop themselves, especially when they come in that young.
Yeah. What a special program. That's what I love most about it, is that, spending 2 years with someone, you do get to know them and you actually become somewhat of a friend.
Oh, totally,
Right?
totally.
Yeah, so-
you are definitely that person that, and that's part of the reason we like to get them in pregnancy, because during pregnancy we make a relationship. When the baby comes, that it's very hard to come in and make a relationship because they're so busy with the baby.
Mm-hmm.
But if you've already got that relationship in pregnancy,
Right.
then when they go into infancy, then they're ready to hear you and listen to you. And what's fun at the very end, some of my clients' babies know my name. I mean, like they can
Because you've
say
been talking
it.
to them all these years. It's Kim.
It's Nurse Kim. Nurse Kim's here. You know,
That's great.
and so that's a fun part of where they'll climb up on your lap at the visit because they know
Mm-hmm.
you're a trusted individual that is part of their life.
Do you know, that kind of made me think about sort of society and how, as we became such a mobile world.
Mhm.
I mean, we moved. People moved away from their families.
Right.
Years ago, it used to be you would be in the same house, maybe with your mother and your grandmother, or you'd be in the same vicinity, and so it was the mom and the grandma that were kind of helping those transitions. So in a way, you're like moms and grandmas helping people understand what's going to happen.
Definitely, that is kind of a role that we are filling.
Mhm.
And because we're nurses, and we also, Nurse Family Partnership has an extensive training, we also, kind of know what we're talking about.
Yeah.
Along the way. And also, I'm a lactation consultant, board certified.
Mhm.
And so I definitely do a lot of teaching on breastfeeding.
Sure. Yeah. So I'm glad you brought that up because we have been doing classes. Are we still doing classes on breastfeeding or helping people, or just do it on an individual basis?
Just on an individual basis.
Right.
WIC does a lot of training in that.
Mhm.
And,
because it's not always as cut and dry as you think.
it's
right?
not easy.
Right. You
For
have to
by
really be
any-
motivated to do it, and sometimes people are just catch on just like that. And sometimes babies aren't as cooperative.
Yes.
But it's nothing wrong with the mother and nothing wrong with the baby. It just is sometimes.
We always just talk about it being a big learning experience.
Right.
And I was with a young woman yesterday, and baby's 6 weeks old, and pretty much she just puts the baby to breast,
Mm-hmm.
and the baby just gets on.
Yeah.
And I remember her first week and how much of a struggle it was, and she was like ready to give up.
Yeah.
Ready to give up, and she just persevered, and we did a lot of, different things to make it easier and help her through that, and just like, yes, you can do this.
Right.
This first week is really, really hard,
Mm-hmm.
but you're
Yeah, stick
okay,
with
and
it.
you can do
Right.
that. And our breastfeeding rates are higher in Nurse Family Partnership are higher than the state's rates
Oh wow.
for breastfeeding.
What do you have that percentage on top of your head?
I want to say it's 6 months. We're like in the 68 percentile,
Oh, great. Good.
which is higher than Colorado's.
Right.
And
Well, that
and
speaks to the success of the program and how that.
Yes.
Because we know breastfeeding is a good start for all babies.
Right.
So we want to make sure that they can do that. Well, it's inspiring I'm sure that women that have worked with you over the years, 17 years. So you have some that are, getting into their 30s. Are they?
yeah, definitely. I ran into, there's one mom I keep contact with because she has a child care
Business?
business in her home.
Mhm.
And so I contact her, do you have any openings?
Mhm.
And her son is I think he's in 8th grade.
Mhm.
I saw him like in the newspaper that he had gotten some award. So that was kind of really cool. Seeing
Right.
like, oh, there's my baby that's now,
Yeah.
succeeding in school. And that's one of the things our program is evidence based.
Mm-hmm.
They follow them for years and years and years afterwards.
Mhm.
They're more successful in school, less likely, the children are less likely to be involved in like crimes as children.
Mhm.
You know what I mean? Like
Mhm.
juvenile
Mhm.
delinquency.
Right. So
Can't think of the exact word that we use nowadays. And, so that is a really, because we're trying to influence 2 generations.
right.
The mom's generation and that next
So
generation to
kids
come.
are less likely to be at risk.
Definitely.
And enter into risky behaviors if they've had a good
enter into
start.
risky behaviors if they are less likely to have kids like in foster care
Mhm.
lately
Right.
because the parents have learned how to parent hopefully and are just so it's a really
Yeah.
that speaks a lot to me because it's like this is not just something we do and we hope it works.
Right.
We know it works.
So the partnership piece is there's several organizations that come together to support the Nurse Family Partnership Program. talk a little bit about that partnership, because we have, the kids, oh gosh, the partners that
Invest in Kids.
invest in kids, and then there's another partnership that
And they have recently taken on Child First.
oh, Children First,
Children First?
maybe, yeah.
I'm not sure what the exact name.
But speaking to the evidence-based nature of the program, is
Oh.
that we know this works, we know that,
Mhm.
and there's a lot of support for Nurse Family Partnership.
Yeah, Nurse Family Partnership exists in like 42 states
Mhm.
in the nation,
Mhm.
and in a few foreign countries as well.
Mhm.
And in Colorado, though, we have a unique relationship with Nurse Family Partnership because Dr. David Old, the founder of our program, is at University of Colorado.
Mhm.
And so he is, so we know who he is.
Right,
I can go up
right.
and talk to him.
Mhm.
He does a lot of the research, a lot of the development
Uh-huh.
of what we're going to
just
do
all,
next.
it's data driven. I mean, so we know the outcomes are good for these kinds
We
of
know
programs.
the
We know that
outcomes.
giving people some help at the beginning of their pregnancy has a better outcome, and it's measurable, which is what I love about the program too.
Yeah,
So
I like the idea to think that, and I see it.
Mhm.
I think living in Montrose has been really good because I see
Yep.
some of these people are still around, and I see them like this woman that's running a successful business in
Right.
her home,
Right.
and just watching that, and she's I feel like one of my success stories. And right after she graduated, she developed cancer
Oh,
and came into my office and said, "Can you help me with CCAP?"
that's
And
great.
I was
Well,
able to help her with CCAP.
That's the Colorado Child Care Assistance Program. So
So that she
yeah,
could get
her treatment and
her treatment
Mhm.
and have childcare for her
Right.
two children. She had a brand new baby.
Mhm.
She found out she had cancer while she was pregnant,
Wow.
and she had a brand new baby and her 2-year-old.
Oh,
He was
wow.
probably like 2.5 at that time.
Yeah.
And just to be able to, like, they know I can come back and I can talk to that nurse,
Mhm.
and she's still gonna help me
How
out.
inspiring that you have the lifelong connection, or a long connection with
Uh-huh.
these folks, and
It's fun to run
really
into
help.
people at
Yeah.
Walmart and
Yeah.
Target and
Yeah, and say, I remember you. That's really great. So connect me with the remarkable woman and what that means to you, and how were you nominated? Who do you know anything about who nominated you, or how that all came about?
Well, I just know someone nominated me, and like it's just like they have it on TV or on the website or something like that. And somebody nominated me, and apparently wrote a good nomination letter
Yeah.
or whatever.
Yeah.
And then they just asked me to
Did you do an interview or
I
something?
did do an interview, and in I want to say the second week of March,
Mhm.
it was on TV.
On KREX, yeah.
It was funny. One of the WIC people, one of the WIC women, came in and said, "I saw you on TV this
Yeah.
morning."
Felt like a movie star. Well,
Yes,
it's
yes.
really one thing to be recognized. It's really special to be recognized for what you've done for the community, and I know that there's a ton of moms that are thankful that you were able to supply that kind of counseling and support and education. And it is really rewarding to be in a small town that you can actually relate to them
See
and say,
those
"Yay,
babies that
yeah, it's
come
really-
along.
It's really
And many
wonderful.
moms will say, like, "If I get pregnant again, will you come back in?" And I'm
Mhm.
like, "No, I'm sorry, it's just for first time moms."
You've already
And they're
gotten the
like,
education, right?
"Oh."
Yeah. Well, but I mean, and that speaks. I mean, there's not a mom that probably wouldn't enjoy having a benefit from, I should say, having from a nurse that could walk you through pregnancy to
Oh,
the
totally.
years. Because that kind of takes you to the terrible twos and how kids can be challenging, and so you
Uh-huh.
cover, your knowledge has to be pretty broad. I mean,
Mhm.
so.
And we work with partner agencies like Parents as Teachers,
Mhm.
and especially for our clients that really feel like they need more, and maybe we feel like they need more, and we will do a handoff to Parents as Teachers, because that goes through age 5.
Right. So you don't just leave them, and
We don't just leave
yeah.
them and say, like,
See ya. You're done.
see you later.
Right.
I mean, and we work a lot with partner agencies,
Mhm.
many of them through Hilltop, and with our local pediatricians and our local doctors. We're definitely a lot about referrals, and also just helping moms in their workforce, helping them get their GED, helping them figure out how to get a job and keep a job,
Right.
those kind of things.
Yeah, I think if I tied your hands together, you probably would be able to talk, would you?
No, I don't think so. I don't have any Italian blood, but that is,
Yeah.
you know.
Expressive. It's really been a pleasure to chat with you about the program, and I think that folks tuning in can learn a lot about what we offer at the Nurse Family Partnership Program. So feel free to call the county and learn more if that kind of applies to you, because your referrals comes from doctors' offices and
They come from doctor's offices or WIC or other places, but feel free. Our best referrals are self-referrals, or somebody, a family member says,
hey, you got to do this.
hey, yeah, and they'll call and they'll say, do we have permission to call and tell them about the program?
Right.
And if we have permission, and so the best way to do that is just contact my supervisor, Buffy Smith, and it's 970-252-5015.
Well, there you go. So now we have the information. Kim, I want to thank you for taking the time so you can
Thank
tell us
you.
about the program and celebrate your nomination as a remarkable woman. I think you're pretty remarkable too.
Oh, well, thank
Always
you. I
enjoy
think you are
talking to
too.
you. So I appreciate you joining us for County Talk. I hope you tune in to one of our next episodes. But right now, you've learned a little bit about the Nurse Family Partnership. You can call the number that Kim referred to and learn more about that if you want to. So I'm Sue Hansen. I'm signing off, and we'll see you at the next episode of County Talk.